use this? And it's like, well, let's look at it from a health lens. First off, was there a good reason for this person to use this? And I would say that, if you want to lose 5 pounds for your upcoming cruise or something, that's not a good reason to be on an incretin-based therapy. But let's say that this person has cardiovascular risk factors, or who has cardiovascular disease and who needs to restore insulin sensitivity and lose weight. Well, yeah, it's a good reason to use these things because they reduce cardiovascular events and they do it by helping you control your insulin, control your life. Well, that's always a win for me. And, sometimes people need them long-term. Sometimes people can use them as a catalyst. And hey, regardless, if you are healthier and you are minimizing your risk of cardiovascular disease, then that's a good thing. The problem that happens sometimes is you might skip lunch when you're on one of these medications, but there's no free lunch when it comes to maintaining muscle mass. Now, that said, if heavy weights aren't going to pick themselves up, but if you pull the resistance exercise lever, then you can attenuate the loss in lean mass that will otherwise occur when you're on something like tirzepatide or semaglutide or any of these things. And so you just got to do some work yourself. Additionally, a lot of times people are just not hungry on these medications. And so when they do eat, they just grab a couple goldfish crackers and move on. You really do have to prioritize protein. And my basic mantra for diet is prioritize protein, eat real food. And so, but you really have to get enough dietary leucine in order to continually stimulate mTOR, which is your main growth signal in skeletal muscle that you want on, because nobody ever said, I wish I was weaker. Nobody ever said, I wish I had less muscle. And you don't want to be trading one problem, which could be obesity, for sarcopenia down the line. So that's what I'll say on that. And regardless, whatever we can do to mitigate cardiovascular risk,